My name is Dr. Nitin Chabra. I am a board-certified anesthesiologist. Sedation dentistry is the process of performing dental work under sedation. Typically, you can do it under oral sedation or IV sedation. We perform all of our sedation procedures under IV sedation. Sedation dentistry works by administering medication either orally or through an IV to help you feel relaxed and have a pain-free experience. We perform IV sedation, so you'll have a small IV placed in your hand and receive medicine through that IV to help you basically have a nice nap during your procedure. Probably the most common benefit is if somebody is anxious or has a phobia of dental offices. So typically you can get your work performed in a much more comfortable, pleasant setting. The other big advantage is the amount of work a patient has to have done. If there's a lot of work that needs to be done, it's just not comfortable sitting in a chair for 2 or 3 hours, and sedation dentistry can make it a lot more comfortable and pleasant. So the ideal candidate for sedation dentistry would be a patient who is really anxious or really fearful. Somebody's had a bad experience with a dental office in the past. Also, patients who have to have a lot of work done or more invasive work. So typically, if you're going to the dentist just for a filling or something small, you don't need sedation dentistry. But if you have to have teeth taken out, like wisdom teeth or implants placed, or something that's just a little more complicated, that would be another patient who would do really well with sedation dentistry. Most patients end up sleeping through their procedure and they wake up at the end and all their work is over, and they usually go home very happy. Typically, when you go home, you'll still be a little bit tired and want to sleep for a couple hours, and the medicines will have worn off by the end of the day, so you're back to your normal self within 24 hours.